Well, today is World AIDS Day, the 35th time the world is uniting to remember and pay tribute to those we have lost to HIV or AIDS, and to emphasize our collective responsibility to ending the HIV epidemic.
Approximately 1.2 million Americans are living with HIV nationwide, according to the CDC. Ryan Jenkins shares how that number breaks down here in Wisconsin and shares more on the progress being made in fighting the deadly virus.
In those early days, there was a lot of uncertainty, and it was just kind of a nightmarish situation where no one really knew what was happening.
On World AIDS Day, well-known performer and LGBTQ advocate BJ Daniels remembers those they've lost to HIV and AIDS throughout the years.
Remembering Richard Ginger today is great. Also, another dear friend, Holly Brown, remembering Holly Brown today. Another dear friend, Robert Steinfort, Abby Rhodes, Josie Blake. The list can go on.
BJ says they remember a time here in Milwaukee when they lost 3 best friends to AIDS in a single year, when the community rallied to try and learn more about this deadly disease.
People that were diagnosed with AIDS in the later part of the 80s, the real help medically didn't come until the mid-90s.
Now thankful to live in a time where advancements have been made.
You knew that it was a death sentence at that time.
An HIV diagnosis is no longer an automatic death sentence, but the virus is still spreading. There were 289 newly diagnosed HIV cases in Wisconsin last year. According to a report recently published by Wisconsin DHS, there are more than 7,300 people known to be living with HIV in Wisconsin, and the state believes another 1,063 could be living with HIV and not even know it. It's why the work at Diverse and Resilient continues to connect people to resources and treatment. This year, in memory of Ronnie Grace, a passionate advocate for HIV awareness who died earlier this month during a battle with cancer.
We need a full community to really stand up and address the fear that we have about the HIV virus.
Justin Roby, who is also the co-chair of a statewide action group on HIV, says we have to beat the medical mistrust and lingering stigmas.
People, especially people who identify as Black and LGBTQ and cisgender men, they are tired of being sampled in HIV research, and there's no results on the other end.
In 2022, Wisconsin DHS says people of color accounted for nearly 70% of newly diagnosed HIV cases, despite representing only 20% of the state's population. Male-on-male sexual contact is the most common transmission risk.
We are moving into what feels like the next generation of treatment and prevention options.
HIV stands for human immunodeficiency virus and can lead to acquired immune deficiency syndrome known as AIDS, which really isn't diagnosed anymore because of advances in treatment. Those treatments include PrEP, which is a pre-exposure medicine that can be given to help prevent the transmission of HIV, and PEP, which is a post-exposure medicine given to somebody who's HIV negative but who has been exposed to HIV. Both of these treatments have been proven to allow somebody to achieve and maintain an undetectable status, which means they get to live a full and happy life.
It's always interesting the dissonance I have with loving to celebrate World AIDS Day, but we don't say AIDS often.
A day of remembrance and commitment as the fight to end HIV rages on. Reporting in Milwaukee, Ryan Jenkins, TMJ4 News.
As Ryan mentioned, much of the progress made in reducing HIV can be credited to education and routine testing. The Milwaukee Health Department has a number of free health clinics. That's why we have the QR code right there for you on the screen. And that will take you to a list with information so you can make an appointment.